When the diagnosis is cancer, you want the very best care possible. And fortunately, in the Boston area, you have a lot of good choices. Well, there is a new center opening in September that was designed by patients for patients, providing a unique experience for those seeking cancer care. It's the new Beth Israel Deaconess Cancer Center in Needham, and we are absolutely thrilled to welcome its director, Dr. Robb Friedman. So good to have you with us.
Thank you. Glad to be here.
This cancer center sounds really special. Talk to me about how it's different and tell me about the design and the layout.
When this cancer center was first conceived, the doctors and staff at the Beth Israel Deaconess Medical Center asked patients who are currently getting their care at the BIDMC to serve on a patient advisory panel. And the patients sat down with the doctors and administrators of the hospital, working in conjunction with the architects and the designers, and talked about what they felt was really important. Patients felt that sunlight was just made such a difference. Having a place that was warm, well lit, staffed with friendly people. Additionally, something came out that I think was really interesting is that patients who were receiving radiation therapy hated being in the basement. I don't know if you know about this, but radiation therapy is given by a big machine called a linear accelerator. It emits radiation that can be used to take care of patients with cancer. The radiation needs to be shielded with a lot of concrete and lead. It's very heavy. And traditionally, it's put in the basement.
Makes sense.
It makes sense. It weighs about 100 tons. Well, the patients felt that it was so important to not be in the basement that the Beth Israel Deaconess Medical Center decided that, by golly, we are going to have the linear accelerator on the same floor as patients getting chemotherapy so they could see the sun. And so it was an amazing feat of engineering, and there are only a handful of cancer centers in the whole entire country. But our radiation therapy is right next to where we give chemotherapy, and patients who are waiting for their radiation therapy will be in the same sunlit waiting room that patients are, while they're getting their other treatments.
It gives me the chills. You're really empowering patients in so many ways. You're healing patients and you're empowering them by giving them a say in treatment for future patients. Tell me about the services that are being offered there, or that will be offered there.
We are going to have top-notch academic medical center care provided at the Needham Cancer Center. Increasingly, cancer care is what we call multidisciplinary. Patients with cancer are best cared for by a team composed of medical oncologists, radiation oncologists, and surgeons, all working together to provide the best plan. Additionally, one of the ways in which care is fantastic through an academic medical center is that we work with a tumor board where there are radiologists, pathologists, other medical oncologists, radiation oncologists, surgeons working together to formulate the best plan. Additionally, the Cancer Center at Needham is going to have a surgical pavilion attached to it that will be part of the Beth Israel Deaconess Needham facility that's going to have 2 world-class operating rooms so that patients will be able to get their surgical care at Needham instead of having to go downtown for most major surgeries.
And it sounds like you will be working closely with the facility, Boston, Beth Israel Deaconess Medical Center, doctors teaming up together.
Absolutely. We, in many respects, are the doctors in Boston, but the care that we'll be providing will just be at Needham. Everyone will be is a staff physician of the Beth Israel Deaconess Medical Center. One of the ways in which we'll coordinate care for our patients at Needham with the Beth Israel Deaconess Medical Center is, in consultation with the radiation oncologists, consider the use of the CyberKnife. The CyberKnife is an incredibly powerful tool to take care of our patients with cancer. At the Beth Israel Deaconess Medical Center, we have the most experience in all of Boston in using the CyberKnife to take care of people who have really tough to treat problems.
What does this mean for cancer patients to have access in the suburbs to truly world-class cancer care?
I think it's going to be immeasurable. When I talk to patients, the one thing that I hear again and again and again is how hard it is to go into Boston. Cancer treatment is hard enough, and the realities of traffic make that commute for people that live out in the suburbs into town an absolutely grueling process. And to be able to receive the same top-notch care minutes away from their home is, I think, an immeasurable benefit. We are going to provide the best care for the patients who live here in our community, and no one has to feel that they're missing out by not getting into the city.
I can see your heart and soul are truly in this, and it will be a wonderful addition to Boston and Needham. Thank you so much for being with us, Dr. Robb Friedman.
Thanks.